It's beginning to sink in. Texting while driving can get you hit with a fine of up to $200 in the state of Missouri if you're under 21. The bill took effect last month but got little attention before its passing. Now that schools are back in session, university students are starting to react to the new law that only applies to some drivers. We set out to get their thoughts.
I think the law is kind of ridiculous because I feel like people are still text and drive. I don't know why you have to be 21, to be honest. I mean, it's not going to change much. I'm 20, and if I'm doing it now, I'm going to do it next year too. But I personally think if people trying to stop people from texting is good, because I know of people that have gotten in wrecks from texting.
I think it's good that they passed it, because I think that it's pretty dangerous that people can text and drive, and an accident can happen in a second. So it's a good idea.
I think it could prevent a lot of accidents that would be caused if you were texting, but I also think that they should not only apply to 21 and under. I think it should apply to, all ages, because someone who's older than 21 and texting is going to be the same risk factors of getting an accident as someone who is under 21. So
while the new law currently applies only to drivers under 21, lawmakers says it could be expanded to include all drivers.
Coming up on Ozarks News Journal, H1N1. What do we need to know? Jaci McReynolds of the Springfield-Green County Health Department joins us to keep us up to date. Stay with us.
Welcome back to Ozarks News Journal. I'm Erica Bray. Today's up-close interview is with Jaci McReynolds. Jaci is the Public Information Administrator for the Springfield-Green County Health Department. We'll be talking today about H1N1, what it is, how to avoid it, and what to do if you think you might have it. Jaci, thank you for joining us today.
Thank you for having me.
Okay, Jaci, let's just start out with talking about the difference between the seasonal flu and H1N1.
Well, the similarity between the two, of course, is that they're both influenza viruses. The difference is that the H1N1 is a brand new influenza virus never before seen in our population, so most of us have no immunity to it. They share a lot of the same symptoms. Both have a cough, a fever of 100 degrees or more, runny nose or stuffy nose, body ache, fever, headache, and tiredness. But the H1N1 also has vomiting and diarrhea, which we don't typically see with seasonal flu. Both of them would have their own vaccination, and so that's something we'll talk about. And then also, they have different groups that they primarily impact.
Okay, who would they impact? Who is at highest risk for this flu?
Well, seasonal flu, typically we would see the senior population, pregnant women, and children. With H1N1, the senior population seems to have some immunity to H1N1, so that's good news for them. The people who are most at risk for H1N1 appear to be children between the ages of 5 and 24, pregnant women, young infants, and then people with a compromised immune system or chronic health conditions.
So how are we going to be able to protect those people as well as protect ourselves?
Well, the best way to protect yourself against any influenza virus is to get a vaccination. However, because the H1N1 vaccine is not yet available, it's really important that people follow some proven disease prevention methods. And those include good hand washing. I know we talk about it a lot, but it's really important. Good hand washing for at least 20 seconds frequently throughout the day. Another thing that's really important is to keep a distance of about 6 feet between someone who is sick and yourself. Also, we encourage people to really keep their immune system strong, and they can do that by making some very simple, healthy lifestyle choices, like choosing healthy foods, getting adequate rest, choosing an active lifestyle, getting exercise. Mm-hmm. Also, by stopping those harmful behaviors like tobacco use and smoking, and to replace them with healthier behaviors as well.
And I understand that well, who should get the vaccine actually? Like who is most important on the list to be getting this vaccine when it does come?
When the vaccine comes, it will arrive in small shipments. An initial shipment probably mid to late October, and then weekly shipments following that. We've been assured from the federal government that they'll continue to produce it until everyone's had an opportunity to receive the vaccination. But initially it will be prioritized for certain groups. Those will include pregnant women, household members or caregivers of infants that are 6 months and younger, and that's because the vaccine is not licensed for them, so we need to build some protection around them. Also in that priority group will include healthcare workers and first responders, children and young adults between the ages of 5 and 24, and then anyone between the ages of 25 and 64 who has a chronic medical condition.
Okay. And I heard that the Greene County Health Department is currently short on the seasonal flu shots. How are you all going to deal with this, and what should the population do to deal with this?
Well, we have had to change our plans because initially we had thought we would go ahead and vaccinate everyone against seasonal flu, and then we would come back and vaccinate everyone against H1N1. We've had to change our plans. Our manufacturer has told us that we will not be getting all of the shipment we ordered, which would typically be about 5,000 doses, and they can't tell us at this time when we will get any of our vaccine for seasonal flu. So the good news is, though, that there are other places in our community that have seasonal flu vaccine available, and so we encourage people to seek those out, whether it's a local pharmacy or their physician's office or other places in the community.
And what if someone feels like they are coming down with the seasonal flu, or they think they might have H1N1 because they're vomiting or diarrhea? What should they do first?
Well, H1N1 has actually been more mild than we would typically see the seasonal flu. So that's the good news. Most people are recovering within 4 to 5 days. What we encourage people to do is go home and go to bed. Just rest and try and keep a distance from other people, especially those within your own household. If you can keep yourself in one room of the house, just limit yourself to one bathroom as well, that's great. It will help protect those people who live with you.
What if it's
Sure.
been 4 or 5 days and they're
Sure.
not getting any better?
There are some things to watch for. If you see your fever beginning to spike, if you're experiencing symptoms that are worsening, definitely contact your healthcare provider. Also, if you are a member of a high-risk category and you develop the symptoms of flu, go ahead and contact your healthcare provider immediately, because they may want you to be seen in the office, or they may want to prescribe some antiviral medication for you that can help reduce those symptoms or reduce the number of days that you're actually sick.
Okay. And the CDC has released information daily about the H1N1 virus on its website. Should locals kind of keep tabs on that website and see what's going on around the nation as well?
Well, the Centers for Disease Control and Prevention is a wonderful source of great information, so of course we encourage people to follow their website. We also have a local website through the Springfield-Green County Health Department, but there's also a website called fighttheflumo.com, and this is a grassroots effort across the entire state of Missouri that provides all kinds of information, fact sheets. We have posters on there. We also have links to our social media tools like Facebook, YouTube, our blog, and Twitter. So I encourage people to check out fighttheflumo.com.
And is there anything else that you would want people to understand about this new flu that's coming, and as well as about the seasonal flu, what to do this winter so that they don't lose time at work or their children don't become sick?
What's really important for people to do is keep in perspective the true risk of H1N1, the true risk of seasonal flu. Both illnesses come the same way, they're spread the same way, have the same symptoms, the same treatment, so there really is no difference in whether or not you have H1N1 or seasonal flu. We also want people to really consider the importance of protecting their community by staying home themselves if they are sick. It's not good enough to pump yourself full of fever-reducing medication and then go to work, because you're still spreading the virus. It's very important that everyone stay home. And then I can't overemphasize the importance of washing your hands frequently.
And how worried should residents be about getting this H1N1 virus?
Well, we know that flu viruses can constantly change, and so there is a chance that the H1N1 could become more severe. We want to keep that in perspective, though. Right now, it's been mild. The majority of cases have been mild, and people have recovered just fine. So it's good to be cautious, it's good to be aware, to follow those disease prevention methods, and just stay tuned to a credible news source and with your local public health department.
Well, okay, it looks like we're out of time, Jackie. Thank you so much for being here. This has been very informative. Don't go away. Ozarks News Journal will be right back.